day, Dr. Sir Descravier. Video. Oh, wait lang. Hindi ko alam kung natatanggap niyo yung audio ko. Okay, ulitin ko na lang. Good day, Dr. Sir Descravier MD, and welcome to another video my YouTube channel. Galing ko sa isang medical mission, I think. Nakita ko, or I mean, nagpost ako kanina. Galing kami sa Ilagan. Major medical mission from the request of the government. Mabot kami ng 130 patients. Anyway, this evening, magpo-post ako ng isang video. Part of my commitment for health education. Start tayo last time with ankylosing spondylitis. And hopefully may natutunan kayo with regards to AS, which is a autoimmune disease. Now, jump ship tayo sa isang dermatologic condition. Simula rin sa letter A. Tayo sa ating may picture akong papakita. Credits to dermnetnz.org for providing us a photo. Kung mapapansin nyo dito sa image na to, napaka-typical nitong problema ng mga bata, tanda, lalo na sa tag-init. Kapag madalas tutok sa araw or nagpapawisan, kung napapansin nyo to, ito, hindi ko ma-identify if this is or sa likod. It's a holding area of the body, no? Or we call it an intertriginous area, okay, na-fold. And mahalaga yan kasi yan yung area of concern natin na karamdaman na ipapakita. Now, madalas kapag may ganito kang findings sa inyong balat, makati yan, sobrang kati. And usually kapag ganyang presentation, kinakamot natin. And pag napansin nyo to, zoom natin, credits again to dermnetnz. Yan. May areas na kinamot na dun sa image. So there is already a secondary excoriation. Tinatawag natin. Yung balat. Because of too much pruritus. Okay. Another image that is very related is this one. Nyo dito, it's on the elbow area, nangangapal na. There is area of exfoliation and desquamation and redness. Okay? Kapag nagkakaroon ng flaking ang balat, sobrang kati niyan. Typical din yan sa mga areas of concern sa mga people with history of atopy or allergy. Sinasabi ko na yung atopy. Again, this image is credits to dermnetnz.org. So, tignan nyo dito. So, sobrang inflamed yung area. Namumula na siya sa ilalim ng balat. Okay, red siya. There are areas of hypererythema. Exfoliation, meaning na nagbabakbak na yung balat. This is the elbow. So, isipin nyo kung meron kang ganyan, parang sobrang dami ng libag. Yung natatanggal yung skin because of too much dryness or cirrhosis. Iba yung cirrhosis sa cirrhosis, ha? Cirrhosis is skin dryness. Pag ganyan ang nangyayari, it's very pruritic. Other image. This one. Children, ito naman ang other presentations nito. So, the face. Tasan, it's red, hyper areas of pwedeng moist because of area of concern. And kapag kinakamot ng bata yan, would lead to bleeding and secondary bacterial infection. Go, ganun. Or skin infection. Now, ano ba tong sakit na to? Well, some people call it eczema, rash. Ang general kasi ng term na rash. But in dermatology, call it atopic dermatitis. Atopic dermatitis to is atopic dermatitis. So let's go to the journal. From JDD. So what is the atopic dermatitis? Atopic dermatitis condition of the skin, which is a clinical diagnosis, meaning hindi kailangan ng other tests. Is presented with pruritus. Pag sinabing pruritus, ate, okay, the presence of and location of skin lesions and the presence of a family history of atopic. Now, atopic condition kasi is parang it's related to the definition of allergy. Okay. Atopy is a predisposition to an immune response against a diverse, leading to the CD4 to differentiation or production immunoglobulin. So, big words. Ang basic lang dyan would be IgE. Okay? Usually associated with allergens. So, higher response, meaning mas prone sila mag-react sa mga allergen. Ang mga taong with atopy. So, medyo highly sensitive sila in terms of allergies. Atopy. Go back. For atopic dermatitis, yung mga yan, yung image na pinakita. In the intertriginous. You have the children, often present colds, but yan, kadalasan nakikita ang mga patients with atopic dermatitis. Okay, common sites of eczema or atopic dermatitis. Children, pag nakikita nyo sa cheeks, sa neck, hands, sa foot, or sa feet. No? In adults, we often see them in the folds. So, yung folds na pinakita kanina, your elbows, the back of the knee, the hands, the neck, and sometimes even the face. Meron din presentation on the torso, thigh, and the leg. Pero, the higher the intensity yung red, the more area of concern ang presentation ng atopic dermatitis. Which is also similar here. Tingnan pag nakita nyo to. Natin itong image. So, yan. Okay? Mas madalas nagpapakita ang atopic or eczema sa mga matatanda sa may folds. Now, paano ma-diagnose ang family history of atopy and the particular skin? No? Similar sa bata na nakita natin kanina. We go to the definition of atopic dermatitis. Atopic dermatitis, ito lang naman ang mahalaga sa atin sa mga ganito. Typical na nakikita sa mga bata. Dok, may mga rash kasi yung pasyente. Ako, ganito. Rash. You have to identify kung ano yung rash. Kung yung rash niya is itchy, eczema, hyperemic, with exfoliation. So, those are classic. May dalawang criteria tayo tinitingnan. Have the 8 criteria, 2, 1 criteria. Yung 2 plus 1 is simplified, sabi. Pa an Academy of Dermatology, atopic dermatitis. Punta tayo sa American Academy of Dermatology. So, kailangan may features ka. Essential features of atopic dermatitis. That is your pruritus or eczema. So, it could either be acute, meaning very recent, subacute, not that much long, or the length is the duration should be either just within less than a month. Chronic, medyo natutubo more than a month na yung presentation ng pangangate or the eczema. Take note that eczema is will either be yung presentation of cirrhosis or hyperemia, foliation. So, yung presentation ng mga yon should be present sa pasyente. Pruritus and eczema. And then, followed by important feature. Pruritus, eczema, plus important feature would be early age of onset. Atopy. Atopy meaning, let's say, si mama mo may allergy siya sa seafood. Si father mo may allergy din siya sa seafood. So, has a family history of atopy. A history of allergy. Kasi any history of allergy, whether if it's allergic rhinitis, allergic cough, skin allergy, atopic dermatitis din, pwedeng mamana yon. Okay? Kung mataas ang level of atopy sa family, it would predispose a child with atopic dermatitis. Lalo na kung dalawang parents may history of atopy. Cirrhosis is also an. Now, paano yung 2 plus 1? 2 plus 1, parang sinimplihan lang nila. Same lang. 2 must be present. Their pruritus and eczema both must be plus 1 of the following. So 1 can either be atopy, can present at any age. Okay, and then the presence of cirrhosis, prurigo nodules, periorbital eczema or eyelid dermatitis, conjunctivitis not associated with bacterial, viral, other regional. Now, halos pagkapareho lang sila ng definition, pero it just implies na pruritus, eczema, plus either a history of atopy count as a, or can either be even a history of cirrhosis can be counted also as a topic term. Nakalagay pala sa para mas madali. Dun sa acute, subacute, and chronic, acute is usually less than 6 weeks, so 1.5. Subacute is more than 1.5 month. And then chronic is more than 1.5. Chronic is more than 6 months, but more than 6 months. So yung subacute is 6 weeks to 6 months. Chronic is more than 6 months. So yun yung definition. Long-standing eczema. So it must have all the essential features plus one important feature. Aside from that, meron din siyang associated features. They have usually the same vascular response. So may presentation of dermatographism. Tulad kasi redness with the pattern. Tayo ng dermatographism sa Okay, yan. Dermatographism. Pag nagsulat ka, nagkakaroon siya ng drawing. Actually, that's true. That's a correct. That is happening talaga. Mga ganitong scenarios kapag ng trauma, a urticaria or a dermatographic urticaria. Okay? Ano pa? Keratosis pilaris. So, pityriasis alba, hyperlineal palms, ichthyosis, ocular changes. So, si ocular changes, nakita natin to kanina. Picture kanina. Ito. That's one. Ocular changes. Eczema or dermatitis of the eye. Pansin nyo, the normal color is different from dun sa my eyelid. That is usual sa percent with atopic dermatitis. Now, kailangan mo din ma-rule out yung mga sakit kung may atopic ka. Or you're suspicious of atopic dermatitis. Kailangan mo rule out ang scabies. Well, sa hayop, dust mites, insects. Scabies usually para siyang ng mga micro pest. Dapat ma-rule out na. And the treatment is usually para matanggal. Seborrheic dermatitis or dandruff. Isang presentation seborrheic dermatitis. Well, even though the shampoo can contact dermatitis kung may contact with an allergen. Ichthyosis, lymphoma, isang sakit that would be presented, the T-cell lymphoma. Psoriasis, sabi natin ankylosing spondylitis and autoimmune presents with its sign, dudugo yung sugat. And kailangan mo rule out lang yung mga yan. Now, bakit ko kailangan ito ipahiwati? Kasi madalas kasi natatakot na yung mga pasyente, yung mga kulang kung ano gagawin ko. Ano ba yung kailangan natin treatment kapag yung matagal topic? Ano ba yung treatment? Well, you have to check doctor. Check your patient. Kasi clinical siya, but person that would diagnose the patient should still be a doctor. Hindi lang ikaw. Baka kasi kung ano yung pinapahid mo dyan, ipapakay-pahid mo, langis, okay, maging irritant pa siya lalo. Baka magpahid ka pa ng binudburang amoxicillin, mas malalong hindi maganda yun, no? So, it will do more harm than good. Iwasan natin yung mga ganon. Seek consult, clinical advice. Clinical diagnosis ang kailangan, so you need a clinician, a doctor. No? So, usually kapag ganyan, we advise the patient or the family to seek our help para ma-check natin. Okay? Kung papasok ba siya sa diagnosis ng atopic dermatitis. Now, kapag pumapasok siya sa diagnosis ng atopic dermatitis, provide kami ng karampatang solusyon. It could either be your application of steroids. There is low potent, high potent, mid potent na steroids. Now, syempre, hindi ko yung babanggitin dito sa stream for the purpose na baka mamaya gamitin nyo pa sa medical consult. It's important for us to be guided by your doctor. Kasi us being your doctors, pinakamalaga is have to see the patient prescribing them. Magkakaiba ang type of cream, ointment na kailangan sa lugar kung saan may sakit or yung lesion na ban. Ba yung sa potent singit, okay? Kamay at saka pan. Halaga makita namin para maging safe tayo. And mamaya gamitin nyo siya pang araw-araw. Ang mangyayari naman dyan, magkakaroon ka ng adverse effect ng prolonged use ng steroids. Kaya mahalaga magpatingin sa isang spesyalista. Pakita ko lang, lalo na kapag bata. Kasi pag bata, minsan sobrang alaga natin sa bata. And kung mas nag-aalala ka kung ang bata ay may ganitong karamdaman, ipatingin niyo na. Okay? Huwag pangunahan. Baka mamaya nagpahid-bahid ng bansanilya. Well, di dapat yun, no? Alamin mo rin, baka mamaya yung patient is a G6PD patient. Baka mamaya naglagay ka ng menthol that is totally di pwede. No? Always seek consult in cases na may ganito. Okay? So then, ang hapdi niyan, ako personally, nagkaroon ako ng ganyan. Ayoko nang maulit. And you should always take care of yourself. Have a good hygiene. Maligo araw-araw. Well, hindi mo maiiwasan ang hindi mo mamamana ang atopy sa iyong magulang. Pero maging handa na lang kung sakali. Kung alam mo yung karamdaman mo, alam mo yung gamot na para sa'yo. Basta't magpatingin ng doktor. Okay? Hanggang dun na lang. Ito siguro, kung over the counter at naging bothersome ito, at yung pa makipapakita sa doktor, o naman lagyan ng hypoallergenic lotion para hindi lang siya mag-further dry up. Kasi pag nagda-dry ito, the more it destroys your skin, the more it expose yourself to infection, the more na magkakaroon ng bacterial infection and more complication. Okay? So, hanggang doon lang naman. Yan. Kaya siguro medyo po for another video. And I hope this video on atopic dermatitis is medyo educational. Simple lang yung mga videos ko and I want the channel to have a health tip na would encompass just the knowledge na para sa lay or sa people that needs it. Well, for a doctor, mas maraming kailangan siyang malaman tungkol sa karamdaman pero mas kailangan din natin may bigay sa mga pasyente natin na ano yung dapat nating turo sa kanila sa mga ganitong sitwasyon. Halaga, maging open kayo sa communication sa doktor nyo para alam natin kung tama ba yung gamutan, kailangan ba mag-adjust, at kailan ang follow-up. Okay? So hanggang doon na lang. Doc Chris here, the Scrubby MD, family physician resident, soon to be, hopefully graduating soon. See you all on the next video.